Good morning, my name is Shafira and I'm gonna explain a bit about cleft lip and palate. So more than 4 million children are born with birth defect each year. The most common one is cleft lip palate, and in order to reduce birth defect, the education for family planning is important. Cleft lip palate occurs more in male than female. Cleft lip palate itself is a fissure or opening or gap in the lips, mostly happen in upper lip and palate, and result from the non-fusion or breakdown of the body's natural structures that was formed in the facial development occurs in week 4 until 12 in intrauterine. Diagnosis is usually made at the time of birth by physical examination, and recent advances in prenatal diagnosis have made it possible to do the diagnosis in intrauterine phase. Cleft lip and palate is included into orofacial cleft. It is the most common birth defect in the head and neck region. Planned pregnancy and the education level of mother can lower the risk of orofacial cleft. They can affect facial aesthetic and functions, including sight, feeding, dentition, speech, hearing, breathing, and psychological development. There are unilateral and bilateral cleft lip and palate. Cleft lip palate itself referred as syndromic and non-syndromic. The most common syndrome are Stickler syndrome and phyllocardiofascial syndrome. The factors that can contribute to congenital anomaly are genetic predisposition, environmental factors, drugs, and the interaction between environment and gene. The environmental factors are maternal nutritional factors, maternal health, medical and reproductive history, maternal lifestyle factors, and also maternal and paternal occupational and other environmental exposures. Maternal nutritional deficiencies can be caused by increased needs, inadequate intake, decreased absorption, and disturbance in embryonic transfer. The environmental factors are smoking, folic acid deficiency, alcohol, teratogenic medications, obesity, and other factors. The goals of the treatments are to repair the birth defect, and then to achieve normal speech, language, and hearing, achieve functional dental occlusion and good dental health, optimize psychosocial and developmental outcomes, minimize cost of the treatment, and to facilitate ethically sound, family-centered, and culturally sensitive care. So it included many multidisciplinary. In order to keep the pregnancy in healthy state, there are some medical conditions that need to be controlled at all times, such as sexually transmitted disease, in example like syphilis and other disease, diabetes, thyroid disease, seizure disorders, and high blood pressure. They should avoid alcohol, smoking, living in a stressful environment, and working around toxic substances. They need to make sure. So this woman that wants to get pregnant needs to make sure that they consume sufficient folic acid. There are some methods that we can use to identify a gene of a disease. These are linkage mapping, genome-wide association studies, exome sequencing, copy number variations, epigenetic, whole genome sequencing, and reverse and forward genetics. The most common method that is used is the genome-wide association studies because it is proven unbiased for the identification of common risk variants. This method is conducted to identify SNPs across the genome that are associated with disease or traits. Exome sequencing provides additional evidence for the involvement of ARH GAP29 in Mendelian orofacial clefting and extends the phenotypic spectrum to isolated cleft palate. The epigenetic markers are DNA methylation and histone modification, and to choose a candidate, we need to take full consideration of the biological role, the gene expression, and functional studies using animal models such as mouse or zebrafish. And then every part of the face are affected by the genes. Genes and epigenetic factors play a role in causation of cleft. In example, like coincidence of IRF6 820GG and MTHFR677CT is a greater risk for cleft lip and palate than the individual genotypes in the population studied. That's all that I can explain. Thank you for your attention.